Welcome back, everybody. Dr. Tyler Williams with Pinecrest Dental in Murray is joining us today, answering all your questions about kids going back to school and how to keep their oral care in good shape while they're back in class. Very important, because we need those chompers to be good on our little kids. So first question for you, what can parents do to help their kids fight cavities while they're going to school?
So every day a parent asks me, I'm brushing my kids' teeth and they're still getting cavities. So we live in a world there's way too much processed food and added sugars. So for most of us, brushing alone isn't enough to do the job.
Fantastic. So do you have any suggestions on what do you do to kind of add on to that?
Yeah, so I like the spray products. We use those at our home because they have a lot of xylitol in them. And there's a lot of brands making xylitol products where it's trace ingredients, so you got to watch it's the first or second. But that, my kids love it. All our patients love it. They taste just as good as sugary candies. And drinking lots and lots of water. People don't drink enough water. And
how do you get kids to drink water? Because, you know, it doesn't taste like anything. So what would your suggestion be on that one?
Just don't buy juice anymore.
Okay. Just don't even have it there.
No, people need water more than they need dental insurance. And that's another one, is I don't have insurance, so I can't come in to get a checkup. But people need water. Preventative care costs less per month than a cable bill. So it's a lot better to prevent than to have to come in and see us to drill their teeth out.
Exactly.
Plus, it's funner for us because we get to talk to kids.
Yeah, exactly.
And have a good relationship.
So let's talk more about that preventative care. You outlined a couple of reasons about why that's important. How many times should they be going? Kind of go down the list of what you would see as the minimal requirements for that preventative care.
Right. So twice a year. It's general rule of thumb. Sometimes we need to see people more often if they get more cavities. But it's a good chance for us to talk about home care, talk about development with children, prevention, things to do, not go to bed with a bottle. That's one we see a lot. It's fine with water, but a lot of kids go to bed with juice because parents say, well, they cry if they don't get juice. And sometimes they have to cry a couple nights and then they'll get used to water and do fine.
Fantastic. Or like you said, don't even have it there in the first place. Right. Now, you know, a lot of kids, parents will say to you, okay, these kids, their teeth are going to fall out. These are their baby teeth. Why is it so important that we are maintaining the baby teeth as well? So what do you say to them?
So the baby teeth maintain our mouth. They have the proper spacing so that our adult teeth have room to come in and our face and head and skull grow properly. And also it's a chance for kids to learn habits. You know, we're lucky we get an extra set of teeth because we get to learn on our baby teeth how to take care of them and how to floss and brush and eat healthy foods. Okay,
I like both of those points. I've got a girlfriend whose 4-year-old is having all this work done, and I'm like, what are you doing? And she's like, we need them to grow right so that she's got spaces for her adult teeth. So fantastic. Where can people find more information about Pinecrest Dental?
So our website's pinecrestdds.com. You can also find us on Facebook, Pinecrest Dental Utah, for lots of tips and back to school oral health.
Fantastic. And then here's some of those products. If you want to give your kids some candy, we do that in air quote, to help those teeth and get that juice out of that house. Thanks so much. We appreciate you joining us today.
It's great.
More information online at goodforutah.com/midday. We'll have weather for you after the break.